very briefly, vaccines have been around for over 1,000 years. They were first used in different forms in China and India in the East. And then over the last 2 or 3 centuries, various scientists and health professionals, medical practitioners discovered the value of that in the Western world. The way in which vaccines work is that our human body, our biological system, has a defense mechanism that is inbuilt in our physiology and biological system, which is the immune system. And the immune system is made up of different types of cells in the body, which are there and they're circulating daily, 24/7 throughout our body, throughout all our tissues and organs, looking out for any foreign invaders in the form, one form of foreign invaders are viruses, bacteria, fungi, etc., any foreign material that is coming through into the body. And particularly, they're looking for the viruses and the bacteria and the various other microorganisms that may invade the body through the skin, through the oral, through the nasopharyngeal system, the nose, the throat, the breathing, the respiratory system, through the mouth, then the oral cavity into the stomach, etc., and any other way in which these microorganisms may enter the body. So these immune system and the cells that make up the T cells and the B cells that make up the immune system will then interact with the foreign microorganisms and then eliminate them in different ways. So that's the basic essence of the immunology, of the way in which our innate immunity and our cell-acquired immunity, there are two types of immunity that we have, is able to detect microorganisms or any other foreign bodies in the body, in any part of the body, and eliminate them through different mechanisms. The main impact it has, the main mechanism is that the cells, when a foreign microorganism enters the body, it initiates an immune response. And the immune system, which is the defense mechanism of the body, then kicks into action and starts producing different types of cells which attacks the microorganisms and either destroys the microorganisms and eliminates it from the biological system completely, or it overwhelms and prevents the mutation and the further growth and spread of the microorganism, be it a virus, a bacteria, or any other microorganism. It prevents it from spreading in the body and causing any destruction, any damage, etc. This immune response is very important to understand, because it is the immune response that also, unfortunately, if it's triggered too strongly, can also have certain side effects, negative side effects on the human body, which I'll briefly mention. So the purpose of the vaccination is very simple. It is to inject or introduce a very, very tiny amount of this microorganism, be it a fragment or a small piece of the microorganism, which is made up of either the RNA or one of the protein molecules, etc. So the way in which vaccination works is we would take a very small part of this microorganism, its protein elements, inject that in the body and stimulate the immune system to react and to build up the antibodies against that particular microorganism. And therefore, if in the future, subsequently, a similar or a variant of that microorganism enters the human body, then the immune system, the defense mechanism of the human body is ready, it is primed, it is ready to go into action and immediately either eliminates and destroys the invading microorganism, be it a virus or a bacteria, or it then prevents any further damage and prevents the vaccine, prevents the foreign invader, the microorganism, from overwhelming the body. So that's briefly the way in which vaccination works. And the vaccination could include either a small fragment of that microorganism, or in some cases, the virus can be attenuated, that is, its virulence and its potency can be removed through various chemical means, and either dead microorganism or an attenuated microorganism or a virus can be used to stimulate this immune response in the body. So that's very briefly the way in which vaccines work. So if we are vaccinated, what it means is that the body's immune defense mechanism is primed and ready for that particular vaccine. In this case, the COVID vaccine. And if the COVID virus enters our body, if our body's defense mechanism and immune system is primed and ready, then two or three things happen. The first thing is the potential for the COVID virus to overwhelm the body, particularly the respiratory system, the lungs, the other body systems, and the organ system. Its ability to spread and multiply is greatly limited. And therefore, the morbidity, which is the side effects of the viral infection, are greatly reduced, and therefore most people would probably have either a mild to a moderate infection, and the body's immune system will then eventually, over a period of days and weeks, overwhelm that microorganism, and they would not have any serious illness. The second very important impact, which is the efficacy of the vaccine, which has been proven through many scientific studies, is that it reduces mortality, which is death. So one of the most serious side effects, the most serious side effect of any infection is eventually the virus or the bacteria, in this case, the COVID virus, overwhelms the organ systems, the cellular mechanisms, the organ system overwhelms the body and eventually causes the death of the person and causes mortality. And therefore, the vaccine has been proven to reduce morbidity, which is severe infection and hospitalization, and secondly, greatly reduce mortality, which is death from the particular COVID virus. So that is the scientific rationale and the basis on which, from a public health and epidemiological perspective, vaccination is absolutely mandatory. And in some countries, even in South Africa, certain childhood vaccinations are mandatory by law, and it is we need to strongly encourage all the people of our country and of our planet to go ahead and receive the COVID vaccination to reduce the morbidity and the mortality. And of course, we've mentioned several times the spread. One of the unique features of COVID vaccine is that it is spread from humans to humans. We do know that it jumped initially from some animal host into the human population, but currently the vaccination is spread from humans to humans. There's no other vector like mosquitoes or ticks or dogs or fleas or etc. through which the vaccination can be transmitted. Therefore, the one very powerful method and the most difficult method to break the transmission, the human transmission of the virus from person to person, is through human transmission. And that is why physical, social isolation, wearing of masks, hand washing to break the chain of transmission is so very important. And therefore, vaccination helps to also reduce the transmission from person to person, and therefore the epidemic waves that is running and wreaking havoc in families and communities and nations can be broken. The chain can be broken through vaccination. So very briefly, colleagues, that's the brief synopsis of answering the question that you had asked, Chairperson.